A mother came back from work to find her 2-year-old child very tired and running a high fever. She was extremely worried, so she brought the child to the doctor at once. "This might just be a cold," she said to herself. "The doctor would probably prescribe the normal flu medications." But then the doctor told her, "Your child is suffering from acute leukemia, or blood cancer." The doctor said that the child has to be admitted to the hospital for urgent treatment, as the condition might deteriorate rapidly. But then reassured her that this form of leukemia is very treatable and responds well to medications. The mother's mind went blank in an instant, and all she can hear is that it is an urgent condition, but at the same time very treatable. How can these seemingly contradictory statements possibly make sense? Let's find out in this video. Do you know what are the top leading causes of death in the developed world, such as in the US? Cardiovascular diseases, a collection of diseases that include heart attack and stroke, got the top spot. Cancers come second. Respiratory diseases will be a distant third. As you can see, cancers do take away many lives per year, so getting diagnosed with cancer is probably the worst news you can ever get from a doctor. But are all cancers lethal? Is there a silver lining to it? First off, what is cancer? Can you spot the similarities between these two images? Neither can I, but according to the father of medicine, Hippocrates, the blood vessels being stretched in a solid tumor is similar to the way a crab spreads its legs, so he named the disease karkinos, which means crab in Greek. By strict medical definition, cancer refers specifically to abnormal self-growth with the potential to spread to other parts of the body. Tumor or neoplasm, used somewhat interchangeably, refer to an abnormal and uncontrolled self-growth, but speaks nothing of its ability to metastasize, which is the ability to spread to other parts of the body. A benign or good tumor do not spread beyond its borders, and a malignant or bad tumor does. Therefore, cancer refers specifically to a malignant tumor, which is aggressive and ready to strike, just like a crab. Why do people get cancers anyway? As with most diseases, it comes down to genes and environment. Genes do play an important role in the development of cancer. People with xeroderma pigmentosum, for example, have an impaired ability to repair DNA damage by UV light. The slightest exposure to sunlight will cause severe burns to their skin. These unfortunate individuals are almost destined to get skin cancers at a very young age, and fewer than half with this genetic condition will live to see their 20th birthday. Environmental exposure to carcinogens are also conducive to development of cancer. Cigarette smoking and air pollution has clear links to the development of lung cancer. Overconsumption of red meat and saturated fat makes colon cancer more likely. Helicobacter pylori infection leads to stomach cancer. Sadly, shift work, or any other work that disrupts the normal circadian rhythm, is also carcinogenic. It is especially implicated in the development of breast cancer. We mentioned that certain tumor can be benign in nature. It's not to say you will live a comfortable life carrying around a benign tumor. Having a benign tumor simply means you experience more localized symptoms, and that the tumor is not likely to be lethal. For example, lipoma is a benign tumor of the fat cells. It can come from almost any part of the body as long as there are fat cells, and they usually appear as soft, painless lumps. Generally, no treatment is required for these type of tumors, but if the tumor grows so huge that it affects one's daily life, or for some cosmetic reasons, surgery might be done to remove the tumor. Uterine fibroids, another common form of benign tumor that will occur to over 50% of women by the age of 50, is a tumor of the muscle in the uterus. Although it does not spread, it can grow so large that it can mimic pregnancy. Women with fibroid might also experience pain, severe bleeding, and compression of the guts causing constipation. Surgery might help these women to alleviate the symptoms. Even among cancers, there are some that have a very low chance of spreading. For example, there are the non-melanoma skin cancers, such as the basal cell carcinoma and squamous cell carcinomas. These cancers, if not treated, can be very destructive to the site it is at, but they rarely, if not never, spread to other sites. Fun fact, the first occupational cancer, That is, a cancer clearly linked to a particular job, as reported in 1775 by British surgeon Sir Percival Pott. He realized that a lot of the chimney sweepers, yes, that is a thing back in the 1700s, had developed skin cancer at their scrotums. You see, back then the British chimney sweepers started sweeping the chimneys at a very young age with no protective clothing. Carcinogenic soot can therefore accumulate on the lower surface of the scrotum. Over 2 decades of occupational exposure, it's inevitable that they develop skin cancer at that particular site. Then there are the cancers that are notorious for growing very slowly. A man in his 90s with heart disease and diabetes recently had difficulty peeing and have blood in his urine. He was diagnosed to have prostate cancer. It typically occurs to men over 50, and over 80% of men will develop it by the age of 80. Theoretically, this man will require treatment. However, considering his old age and his other diseases, the doctor decided to opt for a tactic called active surveillance. This tactic involves frequent follow-up, physical examination, and occasionally biopsy. However, the biopsies proved to be too painful for the patient to bear, so the doctor opted for watchful waiting, which is a fancy term for just wait and watch. Frankly, the cancer grows so slowly that the man is more likely to die of other medical condition than of prostate cancer. There's a saying in medical school that goes like, most men will die with prostate cancer than of prostate cancer. This is not to say you should not treat prostate cancer. A lot of treatment options are available such as surgery, hormonal therapy, radiotherapy, and chemotherapy. They all play an important role in the control of prostate cancer. At the start of the video, we mentioned a child with blood cancer. It might sound horrible as blood goes through your whole body, and these forms of cancers are also notorious in affecting young children. Undeniably, these cancers can progress rapidly and will be lethal within days if no treatment is offered. However, they are probably the most treatable cancers in the world, as most will improve dramatically with chemotherapy, and surgery is not ever needed. Over 90% of children will achieve full remission of the disease and live a normal life. In fact, a lot of cancers nowadays can be treated with a combination of drugs, radiation therapy, and surgery. Cancers are not as deadly as they once were. Urban myth has it that in the very early editions of medical textbooks, the section on oncology, or the study of cancer, was only a few pages long. Nowadays, whole textbooks are dedicated to this rapidly growing field. Rapid development is also occurring in the field of targeted drug therapy. Traditional chemotherapy, which usually consists of a combination of drugs, all act on the cells that are rapidly dividing and do not target the cancer cells specifically. That's why you will see some cancer patients losing their hair when they are on chemotherapy. Cells in the hair follicles are metabolically very active, so the drugs also kill them off. Targeted drug therapy, on the other hand, aims at specific markers on tumor cells to bring about cell death. The 2019 Nobel laureates Honjo Tazuku and James Allison are awarded the Nobel Prize in Physiology or Medicine for their contribution to the field of cancer treatment. They found out that some tumor cells put on a mask of PD-L1 to evade the police of the body, the immune system. If they can use a drug to remind the immune system not to be fooled by the tumor cells, they can effectively teach the body to kill off the tumor cells. So there you have it. Some tumors are in fact benign in nature, and some cancers rarely spread. Some cancers also grow very slowly, and some are highly treatable. There are also exciting new developments happening every day in the field of oncology, so we can expect novel treatment coming out very soon. So, what are your thoughts on cancer? Did this video change your thoughts on cancer in any way? Please let me know down in the comment section.